Parker, and today I'll be talking about how the ways of knowing influence nursing and nurse-client interactions. What are the ways of knowing? According to Patricia E. Zander, who wrote Ways of Knowing in Nursing, The Historical Evolution of a Concept, she states, nursing sought to develop a holistic, individualistic, and therapeutic model of practice that took the profession away from the autocratic, reductionist, and behaviorist characteristics of the medical model. This futuristic evolution of nursing called for a shift away from the ontological and epistemological assumptions associated with old school nursing and nursing education towards a more flexible paradigm. In order to be able to make this dramatic shift, Carper proposed that 4 ways or patterns of knowing be utilized to structure nursing education and evaluate nursing practice. These patterns or ways of knowing were empirics, ethics, aesthetics, and personal. As we have viewed with the regulatory bodies for nurses currently, it is important to update the ways in which we teach and practice to adapt to our ever-changing society, new research developments, and to simply improve our pre-existing system. The inclusions of these ways of knowing Zander addresses would help and still helps provide a more well-rounded, full-picture care to the client. And how they would influence the nursing process during a nurse-client interaction. The empirical way of knowing in nursing includes information. It's based on statements that can be proven, tested, and are considered true according to research. An example of this would be knowing the symptoms associated with kidney disease. This is a foundational part of nursing as it provides information that we can base the rest of our career off of. Personal ways of knowing in nursing are relationships we form with patients and ourselves. They involve welcoming gestures to the clients we work with, showing a deeper level of concern about the individual as an individual instead of a problem to be fixed, and can also relate to being aware of how our own personal viewpoints can influence our care. Aesthetic ways of knowing in nursing involve a critical perspective on the environment in which we work. This isn't to say to have a negative viewpoint, but to be able to analyze our current circumstances and combine it with past events and experiences to gather a more well-rounded picture on our client. It also allows creativity in the way we treat our clients, since every individual is so unique there can be variations in the way we provide our treatment. This would include asking questions about the client to get a more well-rounded picture about other influences in their life rather than focusing only on the influences right in front of you. After getting a better understanding of what the ways of knowing for nursing meant, I wanted to explore some real-life experiences with nurse interactions that go beyond my own viewpoint, as I know it's important in studies to get a different perspective. Due to COVID, I had to choose someone super close to me. This is Riley Parker, my sister. I had the opportunity to interview her about her previous nursing interactions that have impacted her. Riley has scoliosis, so that means that her spine is not as straight as it should be, and she has spent many a times in the children's hospital.
There was someone who was helping me get my x-rays taken, and she was unaware that with these specific x-rays you're not supposed to pose the person with their spine straight so you can actually see how severe their scoliosis is, but because she was unaware of that, she began to try to readjust me so that my spine would be straight in the image, which is not the point of taking those x-rays. I just felt kind of like almost awkward about it, because I was like, if I know that and she's supposed to be the one who's the medical professional here to help people, I feel like she should have more knowledge about that too.
I know that the way that nurses interact with me has an impact on my health care, and after interviewing Riley, I could see that she felt the same way. This shows the importance of providing the best quality of care through all the ways of knowing to provide a more well-rounded health experience that fulfills all the needs of the client. This made me wonder how the difference between a nurse that exemplified ways of knowing and one that lacked ways of knowing would compare in a similar medical situation. This is how I envisioned it would go. Meet Karen. She is a nurse that works at ABC Health Unit in Lethbridge. Today, one of her clients is coming in for a prenatal examination. She has some health concerns regarding her pregnancy. Seeing as she is a first-time mother and can't get a hold of her husband on her phone, she is pretty worked up. If Karen lacked ways of knowing, including empirical, personal, and aesthetic, her interaction with her client might look something like this.
Hello. I'm here for an appointment with Dr. Smith.
Yeah, sure. What's your name again?
Jane Doe.
Yeah, okay. You can take a seat.
Sure. Yes, of course, but do you happen to know how long the wait will be? I'm just a little concerned about how I'm feeling right now. I just want to make sure my baby's okay.
Ma'am, please just take a seat. I'm so sick and tired of people thinking they get certain privileges just because they think they're sicker than everyone else. Please just take a seat. Mrs. Mrs. Doe.
Oh, I'm here.
The doctor will see you now in room 2.
Is room 2 this way?
Yeah.
Okay.
Hello, I'm just here to do some pre-examination questions before the doctor arrives. Do you have anything you're dealing with?
Yeah.
Well, knowing you just came in because you're worried. Your condition is probably the same as last time, and judging by your appearance, you look alright.
I'm not alright. Look at my legs.
My gosh.
What's wrong with them?
I'm not sure, but they don't look too good.
Are me and my baby gonna be okay?
Calm down, you're just overreacting.
That's it. I demand a different nurse.
Now, this example is a little over the top and exaggerated, but I thought it showed how, without implementing the ways of knowing in our practice, clients can't receive the best care possible. Karen, the nurse in this situation, showed a lack of empirical ways of knowing by being unable to identify spider veins, which are commonly associated with pregnancy. Her lack of knowledge, proficient to do her job, and her reaction invoked fear in the client, and anxieties of the situation were amplified. She lacked a sense of empathy, her actions were rude, and she showed no awareness to the client's reactions to her actions. She might have been having a bad day, but that's never an excuse to show a lack of empathy, and she may have had previous viewpoints or beliefs about pregnancy, such as maybe she believes that all first-time mothers are too worrisome. This viewpoint is impacting her ability to form connections with the client. She also lacked aesthetic knowledge in her ability to recognize the situation around her. She refused to get a full picture of the patient's health as she was doing pre-examination questions, and made assumptions based off of beliefs and perspectives that she felt and could view. Even if the client seems to be a standard textbook case, it's important to gather extra information that may be critical and analyze the complete picture to offer the best care possible. Now, let's rewind and see what it might look like if Karen, the supposed nurse, follows the ways of knowing.
Oh, hello there, Mrs. Doe. How are you doing today?
I'm doing good. How are you doing?
Oh, good. Are you here for an appointment with Dr. Smith again? I'll just get you checked in right away.
Okay, thank you. Do you know how long the wait will be? I'm just a little bit anxious about me and the baby.
He's a little behind schedule right now, but he'll be getting caught up real quick right here. So it'll just be a little short wait. Do you have anything I can help you with while you wait?
Not right now.
Okay, if you just take a seat, he'll be with you in a minute.
Okay, thank you.
Oh, Mrs. Doe, the doctor will see you in room 2 right now.
Okay, thank you. Is it this way?
Yeah, just down the hallway and to the left.
Okay.
Hello, Mrs. Doe. I'm just here to do some pre-examination questions before Mr. Smith comes in. Dr. Smith comes in. Do you have any pre-existing conditions or any new changes since last time you've been here?
I've had lots of troubles breathing, and something has appeared on my legs.
Oh, okay. Yeah, I'll make sure to write that down in the notes so the doctor sees. Nothing to be worried about though. Those look like spider veins and, well, those just happen to come with pregnancy. Anything else that you need to tell me before the doctor comes in?
No, that's it.
Okay. Okay, I think that's all. Is there anything I can do for you while you're waiting?
No. Thank you.
In the second example, we can see how the ways of knowing help provided a better quality of care for the patient as she was more reassured, she was feeling more comfortable as she built relationships with the nurse, and she had her care personally adapted to what her needs and interests were. In conclusion, this study has been very helpful in helping me understand the ways of knowing to a deeper extent. I've been able to learn, reflect on, gather evidence, and predict ways in which the ways of knowing influence nursing practice. Empirical ways of knowing help us and the client feel confident. Before doing this project, I believed that empirical ways of knowing were mostly for the nurse's benefit. But as I went on and questioned my thoughts and beliefs, I realized that it is so that we can provide better quality of care to others. It may help us feel confident to know what we are doing, but it also helps the public image and trust of nurses to remain high, like Florence Nightingale strived so hard to create. Through empirical, we are able to continue self-regulating. If we are expected to self-regulate, but the regulatory bodies are not upholding practice standards, nurses will fail to provide safety and quality health care, and I imagine the self-regulatory powers that nurses possess will have been taken away from us. Personal ways of knowing influences the nursing process by guiding us to be more empathetic caregivers to allow for more meaningful relationships. This influences the way in which we hold ourselves during our interactions and the ways we regard others. It can be the difference between a client feeling isolated and resentful during their stay or being slightly more comfortable seeing a smiling face and a warm greeting. My preconceptions of personal ways of knowing were also wrong, as I thought it stopped after simply being kind and courteous. My new perspective on it is that an important aspect of this way of knowing also includes a reflexivity and being able to identify and question personal beliefs and values. At first, I didn't regard this as part of the way of knowing, but after a part of my interview with my sister, I realized that while we disagree about topics all the time, my willingness to listen to her perspective and truly analyze the situation from an external viewpoint allows me to form these strong relationships I have. By being more aware of our own bias, belief, etc., we can monitor the way it influences our interactions with others. Thus, via self-awareness and reflection, we are better able to be more genuine, empathetic, and be better listeners and support. Aesthetic ways of knowing are becoming more and more important to the regulatory bodies as we see more implementation of holistic viewpoints, critical thinking, and application beyond textbook knowledge. An example of this would be by doing a patient assessment to learn more about historical and present influences in their life. The change in curriculum and the NCLEX assessment reflect this emphasis also, as it focuses more on the actuality of nursing versus nursing in theory. This way of knowing influences nursing practice as it causes nurses to become more wholly involved in the care of their patients. To know a more rounded picture, we have to take a step back and gather information. I've learned that this may be inhibited by our own values, beliefs, and preconceptions. It may be easier to overlook important influences in a person's life if we are either ignorant to them or use our own value system to judge the importance of them. For example, a nurse who is white may not consider the effect of racial discrimination in an individual's health, as the nurse experiences privilege that prevents that from being an aspect in that nurse's life. Or if an individual doesn't have a religion or cultural ethnic practices, they may not understand why some individuals change their lifestyles according to them. For me, I have definitely questioned my own beliefs and values already in the nursing curriculum. In NSG 1420, we learned that race is just a social concept and is not biological. This made me question my knowledge about race, as previously I believed it to be biological to some extent, but upon examining my own beliefs, I was able to form a new perspective, and it emphasized to me that maybe racial discrimination is an area I should focus on, because if I didn't know that, then there's probably lots of other things in that area to learn. To be able to excel in aesthetic, we must be able to reflect on ourselves in relationship to the situation and be creative in the way we handle interactions. This actually pushes nurses to become better, as reflexivity and experience with problem solving and application can cause growth. In order to be the best nurse we can, not only do we have to implement a more well-rounded care, we ourselves must become more well-rounded. The ways of knowing exemplify the importance of knowing more than just facts, being more than just polite, doing more than what's expected, and thinking beyond the barriers we have set for ourselves. The ways of knowing simply all lead back to a cycle of learning. By continuing competency, we maintain our skills and knowledge. By observing the patient's reactions, we can see how to better provide personal care. By being critical of our own beliefs and willing to listen to others' input, we gain more information to apply aesthetic. I would like to suggest that all the ways of learning fall under one category of growth. Nursing is a lifelong process because it is when we are willing to continually improve, reflect, observe our weaknesses, and learn new information that we are able to provide the best nursing care.